If your muscles twitch when we're trying to fall asleep, and you wake up feeling weak or shaky, it's easy to assume something serious is happening. Most of the time, it's your nervous system and muscles reacting to a few common pressures. Think of twitching as extra electrical noise in a muscle, and morning weakness as your body starting the day with a low battery. Sometimes that battery is low because of sleep disruption. Sometimes it's dehydration, low minerals, or a hard workout that hasn't fully recovered. And sometimes it's stress hormones keeping your system on alert, even while you're lying still. The good news is you can usually narrow it down by patterns, when it happens, what makes it better, and what else you feel. In the next minutes, we'll build a simple mental model so you can sort normal from not normal. Moving to slide 2. First, let's separate a few sensations that people lump together. A twitch is a brief, small muscle jump you can sometimes see under the skin. A cramp is different, more painful and sustained, like the muscle locks. Restless legs is more of an urge to move, often with uncomfortable crawling feelings, and it improves when you move. And morning weakness can mean true loss of strength, or it can mean heaviness, fatigue, and slow coordination right after waking. That distinction matters because the causes differ. Twitches often come from nerve excitability. Cramps lean more toward muscle fatigue, dehydration, or electrolyte shifts. Restless legs has its own triggers, including iron status and certain medications. So before you chase supplements or scary diagnoses, get specific. Ask yourself, is it visible twitching, painful cramping, an urge to move, or just a drained feeling when you stand up? Moving to slide 3, here's the core idea. Muscles move when nerves deliver signals. And those signals depend on chemistry. Sodium and potassium help create the electrical impulse. Calcium helps the muscle contract. Magnesium helps it relax. Your body keeps these tightly regulated in the blood, but small shifts at the tissue level can still change how irritable a nerve muscle unit feels. At night, you're still, you notice more, and the brain's filtering changes as you drift towards sleep. That's why benign twitching often feels louder in bed. Morning weakness can happen if the same system is running inefficiently, like when you're slightly dehydrated, underfueled, or you slept poorly and your stress response is high. None of this automatically means disease. It means your system is sensitive, and the goal is to find the sensitivity trigger: recovery, fluids, minerals, sleep depth, or stimulation. Moving to slide 4. One of the most common boring explanations is also one of the most powerful: sleep disruption. When you don't get enough deep sleep, your muscles don't fully downshift, and your brain's motor system can stay more reactive. You might also wake more often, which increases your awareness of small twitches that would otherwise pass unnoticed. Sleep fragmentation can come from late caffeine, alcohol, heavy meals, overheating, pain, or even a partner snoring. And if you wake up repeatedly, you can feel weak simply because your nervous system never fully reset. A helpful clue is timing. If twitching is worse on nights you sleep lightly, and morning weakness improves after a solid night, sleep quality is a major driver. The practical takeaway is not sleep more as a slogan. It's to identify what breaks your sleep continuity and remove one factor at a time. Moving to slide 5. Dehydration and electrolyte shifts are another big category, especially if you sweat, exercise, or drink alcohol. You don't need severe dehydration for nerves to become a bit more excitable. Even mild fluid loss can concentrate electrolytes and change how muscles fire. Morning weakness can also be a volume issue. If you're a little dry, your blood pressure can run lower when you first stand, and you feel wobbly or drained. Clues include dry mouth, darker urine, headaches, or cramps along with twitching. Also notice if symptoms follow long flights, hot days, sauna use, or intense workouts. The balanced approach is to think in terms of consistency rather than extremes. Regular fluids across the day and enough salt and potassium from normal foods often matter more than chugging water at night. If you're restricting salt heavily, that can be relevant too. Moving to slide 6. Magnesium gets mentioned constantly, and there's a reason. Magnesium helps muscles relax and supports nerve stability, but it's not magic, and twitching isn't always a magnesium problem. Low intake can happen with restrictive diets, heavy alcohol use, or certain gut issues that reduce absorption. Potassium and calcium matter too, and so does overall nutrition. Morning weakness can show up when you're underfueled, especially if dinner is very light, you train hard, or you're in a calorie deficit. Your muscles may feel flat, and your nervous system may feel less responsive. A useful pattern is whether symptoms improve after eating and hydrating, or after a rest day. If yes, think recovery and nutrition. If no, we look at other buckets like stress, medications, or medical conditions. The key is not to self-diagnose from one mineral. Moving to slide 7. Exercise is a frequent trigger, even for people who feel fine during the day. After training, muscle fibers have tiny microdamage, and the nervous system increases signaling to coordinate repair and adaptation. That can show up as twitching at rest, especially in the muscles you trained. Morning weakness can happen if you trained late, trained harder than usual, or didn't recover. Sleep, protein, carbs, and hydration all play roles. Another clue is location. If twitching is mostly in calves after a run, or in triceps after a lifting day, that's a strong hint it's workload related. The fix is usually boring. Adjust volume, add rest, and avoid stacking intense sessions with poor sleep. If twitching is widespread, unrelated to training, or paired with true progressive weakness, that's when you stop blaming the gym and look wider. Moving to slide 8. Stress and anxiety can absolutely amplify twitching, and it's not all in your head. When your body is in a higher alert state, adrenaline and cortisol shift how nerves fire. You breathe a little faster. You may hold more tension, and you often consume more caffeine or scroll later into the night. That combination raises excitability and lowers recovery. Morning weakness can be the after effect of a night spent in shallow sleep with a revved-up nervous system. A useful check is whether twitching increases during stressful weeks and decreases on calmer days or vacations. Another clue is the presence of other stress body signals: jaw clenching, headaches, stomach flutter, or a racing mind at bedtime. The goal here is not perfection. It's reducing the inputs that keep your system spiky at night and building a steadier wind down so your muscles can fully power down. Moving to slide 9. Stimulants and certain substances can be sneaky contributors. Caffeine has a long half-life, so an afternoon coffee can still be active at bedtime for some people. Nicotine is also stimulating. Alcohol may make you sleepy at first, but it fragments sleep later and can worsen dehydration. Even some pre-workouts and fat burners increase nerve firing. Morning weakness can be the combination of broken sleep plus a mild rebound effect. Your system is tired, but still wired. The pattern to look for is dose and timing. If twitching ramps up on days with more caffeine or after alcohol, that's a strong signal. You don't have to quit everything forever, but if you're troubleshooting, it helps to run a clean experiment for a week. Earlier caffeine cutoff, fewer stimulants, and see what changes. Moving to slide 10. Medications can also play a role, and this is where it helps to be methodical. Some antidepressants, stimulants, asthma inhalers, and certain antihistamines can increase jitteriness or muscle twitching in some people. Diuretics can shift electrolytes. Statins can cause muscle symptoms in a subset of users, usually more aching than twitching, but it's worth noting. Morning weakness can show up if a medication affects sleep architecture, blood pressure, or muscle metabolism. The important rule is, don't change or stop a medication on your own. Instead, track the timing, when the twitching started, what changed, and whether it correlates with dose changes. Bring that timeline to a clinician or pharmacist. It turns a vague complaint into something they can actually evaluate. Often the answer is an adjustment, an alternative, or simply ruling it out. Moving to slide 11. Now let's talk about conditions that can sit underneath these symptoms. Thyroid imbalance can change energy levels and muscle function. Low iron, especially low ferritin, is linked with restless legs and can worsen sleep quality. Vitamin B12 deficiency can affect nerves and cause odd sensations, sometimes alongside fatigue. Blood sugar swings can also matter. Some people wake shaky or weak if they dip low overnight, especially with certain diets or diabetes medications. And sleep apnea is a big one. Repeated breathing interruptions can leave you unrefreshed, with morning headaches, dry mouth, and daytime fatigue that feels like weakness. None of this can be diagnosed from symptoms alone, but it gives you a smart checklist for what to discuss if the problem is persistent. If you've tried the basic lifestyle levers and nothing changes, labs and sleep evaluation become more reasonable next steps. Moving to slide 12. A key question is when twitching is still likely benign and when it deserves faster medical attention. Benign twitching is often intermittent, localized, and not paired with true loss of function. It may flare with stress, caffeine, or workouts, then fade. Red flags are different. Progressive weakness that worsens over weeks, dropping objects, trouble climbing stairs, or visible muscle shrinking are worth prompt evaluation. Twitching with numbness, significant pain, or new coordination problems also matters. So does twitching plus symptoms like fainting, chest pain, or severe shortness of breath. Another red flag is severe cramping with confusion or heart palpitations, which can suggest a bigger electrolyte issue. The point isn't to scare you, it's to give you a clear boundary. If you're unsure, it's reasonable to get assessed, especially if the pattern is new, persistent, or escalating. Moving to slide 13. If you want to troubleshoot this logically, use a simple 2-week tracking plan. First, write down when twitching happens, where it is, and how long it lasts. Add sleep quality, caffeine timing, alcohol, workout type, and hydration. Then, rate morning weakness from 1 to 10, and note whether it improves after breakfast, fluids, or movement. This creates patterns you can act on. For example, if twitching clusters after late workouts, shift training earlier, or reduce intensity for a week. If it clusters after alcohol, that's a clean lever. If it's worse with high stress, prioritize a consistent wind down and earlier caffeine cutoff. If it's random and persistent, that's useful information too, because it supports getting labs or a sleep evaluation. The goal is not to obsess. It's to replace worry with a clear experiment and a clearer conversation with a professional if needed. Moving to slide 14. Let's tie it together. Note twitching plus morning weakness usually comes from a few overlapping buckets: sleep depth, recovery from exercise, hydration and electrolytes, stimulants, and stress. Underneath that, there are medical contributors like iron status, thyroid function, B12, blood sugar issues, and sleep apnea that may be worth checking if symptoms persist. Your job is to look for the simplest pattern first, and make one change long enough to learn from it. If you want one starting point, it's this: protect sleep continuity, keep fluids steady, and avoid stacking late caffeine with late intense workouts. If you found this helpful, subscribe for more calm, practical breakdowns like this. And for a quick check-in, comment with A or B. Is your twitching worse after caffeine or worse after exercise? This information is not a substitute for medical advice. Live simply.